Good morning, it's Dr. Garza here today, and for my Tuesday talk this week, I would like to go over a very unique test that we order with some patients related to treatment of mental health. As you know, in our practice, we treat the whole person and offer comprehensive care of young people and teens, and that includes the evaluation and treatment of mental health concerns. Many patients come to me specifically for mental health evaluation. I get referrals from therapists in the community, pediatricians, other specialists when that is identified in their visit and they feel like our evaluation and treatment could help improve the health of their patient. And so we, talk to patients about depression and anxiety, learning differences, ADHD, eating disorders, all of those things that are under the umbrella of mental health. And then we talk about treatment. One part of treatment are medications. And I tell patients, this medication is one tool to help patients improve, but they are not magic pills. They are only effective when combined with therapy, when combined with self-care, with getting enough sleep, adequate nutrition, working on building healthy coping skills. And so I do medication management of mental health with my patients, but it's not the only answer, and it cannot be kind of a standalone response to mental health, especially in teens that are developing, growing, and maturing. So the test is the GeneSight test. And I have a sample here that I'd like to show you. And what the GeneSight test does is it looks at how the patient's genetics interact with medications that are available for the treatment of mental health. And it's a very easy test to perform. It's just a cotton tip swab inside the cheek. We get the result back in about a week. We send it off to the GeneSight company, and they give us a very nice report to interpret and use to help guide medication changes and medication choices for our patients. Now, this test can be done at the onset of treatment. Some parents feel most comfortable in having this information before we start medication treatment of mental health. And other patients, we save this when we don't get the expected response to our usual medicines, or if patients are having lots of side effects to our usual medicines and we're trying to decide what is the next best step to help them feel better. So it gives us a really great readout. I'm going to try to hold this up in front of the camera. It shows green, yellow, and red, and essentially the way we interpret that is green are medications that are likely to work well with minimal side effects. Now, they're not 100% guaranteed, but they are ones that we hope would be most effective. The yellow category have footnotes, and those have like little kind of cautionary pieces that we might use the medicine, but we'd have to use with caution. But for example, one will say lower doses required, meaning a patient's really not going to tolerate higher doses. And if patients are having side effects on a medicine that they're already taking that's in the yellow zone, then I will often switch them to something that's in the green zone. And then the red zone, as you can see, it says significant gene-drug interaction. What that means is that the way that that patient's genetics interact with that medicine is going to cause a lot of side effects and is not going to work well. So this report gives a page per different class of medicine. There are antidepressants, there are anti-anxiety, as you can see here. There are antipsychotics, which I hate that term. I tell patients this every time. I said, we use these medicines for lots of different reasons, and I think that term is really puts patients off and makes them worry. There also are mood stabilizers. Then we get a readout of the different genetic makeup of the patient and how that would affect how the medicine works and maybe what side effects to watch out for. And then we also add on a test for MTHFR, mutations, which I can go over that as separate visit that or separate talk. That's kind of a detailed discussion, but that also relates to brain health and mental health. So that test is really helpful. Many families feel very informed and reassured knowing this information when we're treating with medications, and it's something that we offer as part of our comprehensive approach to care, especially related to mental health. All right, thanks, and I hope you found that informative.